Thank you very much, Director. It's a forecast. We'll keep that in mind as we move to our second panel.
Thank you again.
Regarding the state efforts to improve our adaptation and resiliency and what next steps we may take. So we have the secretaries here from the Department of Food and Agriculture. We have Karen Ross. We have Secretary Dooley from the California Health and Human Services Agency, Secretary Matt Rodriguez from the California Environmental Protection Agency, Secretary John Laird from the California Natural Resources, as well as Deputy Director from the Governor's Office, Ms. Christina Curry, and we don't have Alex. We have the Deputy Director from the Governor's Office of Planning and Research, which I screwed up. Louise Bedworth, please come forward. I understand that the Assembly Budget Committees may have a couple of our secretaries there, so we'll get started with everybody's individual testimony and proceed as best we can. Who would like to go first?
Well, why don't Mr. Chair, Matt Rodriguez, I'm the Secretary for Environmental Protection. Why don't I go first, since I can tell you a little bit about what we're doing right now to coordinate agency and department activities concerning climate change. And then we can go to some of the other representatives here. And I'll filibuster a little bit and give John Laird a chance to get here as well. So, and if he doesn't, that'll allow me to tell you what I think he's doing over at the agency. So let me start off by saying that I was fortunate to spend 24 years in the California Attorney General's office. So as a personal note, I will just say that when I came to Cal EPA, I'd had some experience in the Attorney General's office where you would see occasionally departments or agencies that couldn't come to an agreement on how to harmonize their programs. And as an attorney, that made it rather difficult for me sometimes to represent the state. And it was also a bit frustrating. So I was pleased when I got to Cal EPA and got to be the secretary at Cal EPA. Found that, one, in this administration, there's a great interest in avoiding that sort of interagency rivalry and fighting that one sometimes finds in administrations. And two, we had in place to deal with climate change an organization already, the Climate Action Team, that was established to deal with issues related to climate change. And it was a group that was started by an executive order by the governor. And there are references to the Climate Action Team within legislation. It was referenced in AB 32. And there have been subsequent references to the Climate Action Team as well. The Secretary for Cal EPA is the chair of the Climate Action Team. And through the years, it has grown to include representatives of, as I like to say, anybody and any department that touches climate in state organizations. So we routinely have representation at our meetings from the Natural Resources Agency, from Health and Human Services Agency, from the Energy Commission, from the PUC. And what the goal is to have the Climate Action Team provide a forum for discussion of what we're doing in our various programs, make sure that all the other departments and boards are informed about the activities that are going on at various levels of the state government, and identify areas where we can be working together more collaboratively, or areas where there are issues of common concern. We meet quarterly. Cal EPA has 3 staff members that are devoted to working with the Climate Action Team. Within the climate action team, there are a number of subgroups that meet on common interest areas. I think that there are 10 subgroups, some of them more frequently than others. But for example, there is a coastal climate group that meets. There is a group that's called, somewhat regrettably, the Wet Cat, that discusses climate issues related to water and sees the relationship between water and energy use and how that affects climate change. So it provides a good forum for discussion. Some of the things that have come through the CAT in recent years, for example, we just completed a research plan that came out of the research subcat, which is headed up by Chair Weismuller of the Energy Commission, and it was to identify areas where we need to do additional research on climate issues. Another report that has come through was preparing California for extreme heat. That was a matter that was worked on collaboratively by the Department of Public Health and Cal EPA. And that has morphed into an additional work that we're doing and funding at Cal EPA, an urban heat island index study to identify urban areas that are likely to and are already suffering from extreme heat issues. Other reports that have come through the CAT include a climate change indicators report that was prepared by the Office of Environmental Health Hazard Assessments, which identified some of the changes that we feel were already seen in California relating to climate change. I will say that the initial focus of the CAT was more on mitigation and mitigation measures. And an effort to make sure that our programs are all coordinated and we're working in concert to reduce greenhouse gas emissions and see what we can do with our various programs. But Secretary Laird and I have talked about the fact that it provided an ideal forum for a discussion of adaptation issues as well. And so we've had the CAT look at adaptation issues as well. So the 2014 Safeguarding California report that was prepared by the Natural Resources Agency was presented to the Climate Action Team, both in its draft form and then in final form. We were updated on changes that had been done to that program. So we've used the CAT to provide a forum for discussion of climate action issues in California, both mitigation and adaptation. As I said, the primary focus has been in mitigation in the past, but we understand that in spite of our best efforts, we need to prepare for things like sea level rise and changes in precipitation. And so we've engaged in discussions on those issues at the Climate Action Team as well. So that's the background, what we've been doing so far on through the Climate Action Team. I don't know if you've got any questions for me at this point, but that provides you a little bit of background on what we've been doing.
I think what we'll do is maybe we'll go through everybody and give everybody a chance and then open it up. All our senators have plenty of back interest in climate change and the environment, so I think we'll hold our questions.
Good morning. Good morning, Mr. Chair and Senators. Diana Dooley, Health and Human Services. The Health and Human Services Agency has 12 departments, or more than that in the agency, but 12 that are specifically related to the climate action and adaptation. Since it was established, the Climate Action Team, the director of the Department of Health, Public Health, who is also the state public health officer, has served and been an active member of that Climate Action Team on behalf of all of the related departments in this agency. Climate is often viewed as an environmental issue, but not so in the work that we do. Dr. Rudolph's comments so well illustrate the enormous impact that climate change does have on public health, and we are actively engaged in addressing and making the appropriate adaptations. There are many health co-benefits of strategies for climate change mitigation and adaptation. The Department of Public Health also co-chairs with the Air Resources Board the Public Health Work Group, and that work group has been meeting for over 5 years quarterly to become a key vehicle for the coordination of activities through our departments with other state agency staffs, as Secretary Rodriguez mentioned, as well as external stakeholders that are engaged in a transparent and public process. I serve as a member of the Strategic Growth Council, which is also working with adaptation and the Health in All Policies, which was the first work product from the Strategic Growth Council, was led by the State Department of Public Health, and the work to implement the principles of the Health in All Policies. Some of those Dr. Rudolph referred to in her comments about active transportation and local government planning and encouraging the incorporation of public health issues in local action in this area. I have with me today Dr. Neil Maslich, who is the epidemiologist lead for the Office of Health Equity, which is a part of the State Public Health Department. And I'd like to invite him to provide some examples of the department's work to adapt to our changing climate.
Thank you. My name is Neil Maslich. I'm an epidemiologist in the California Department of Public Health. I've been a professional epidemiologist for about 35 years in state settings, local health departments, healthcare industry, unions, and many different settings. I'm the lead in the Office of Health Equity in the Department of Public Health on the Climate and Health team. This was established with AB 32 funding to help develop research and technical expertise to evaluate the health and climate questions using the best available scientific evidence. With the Office of Health Equity, CDPH is uniquely positioned to assess the disparate impacts of climate and health on our vulnerable and disadvantaged populations. Through participation in the CAT, we have a mechanism to share this expertise and information with many stakeholders in state government so that they can factor into their plans and guidance the health dimensions. Secretary Dooley and Secretary Rodriguez mentioned the different work groups. The Public Health Work Group, we don't have a cutesy name like WetCat or CoCat or any of the, we're the Public Health Work Group. We're one of these 10 groups that have been meeting quarterly. Incidentally, yesterday we had one of our quarterly meetings where the very topic was health equity and climate change, where we're able to bring in national, state, regional, local health departments to talk about what they're doing in this immense challenge.
We don't use acronyms in our agency. Everyone who knows me says use words, so we call it the Public Health Work Group.
Oh, there you go. We are also members of the other work groups, the ones that have the funny names. So I'm a member of the Research CAT. We have staff who are on the CoCat, on the Communications CAT, on CLUIN, which is the Committee on Land Use and Infrastructure. The message is that even though we're small in numbers, we're trying to spread this public health face to many of our state agency partners, because as Secretary Dooley said and Dr. Rudolph said, people do not immediately frame climate change as a health issue. They think of it as an environmental issue, and we know it's both, and we're trying to bolster that part of our work. As part of things that we do as part of our normal work in the department, we conduct public health surveillance. So that is including public health, heat-related deaths and illnesses, infectious diseases whose transmission is influenced by changes in temperature and precipitation. And this includes preventing heat-related illness, food, water, and vector-borne illnesses such as West Nile virus, which has been previously mentioned. We conduct research into the pattern of deaths, hospitalizations, and emergency room visits related to extreme heat events. So the 2006 heat wave was something that we've spent a fair amount of time analyzing, identifying vulnerable subpopulations and vulnerable places in California that are likely to experience further exacerbations when heat waves occur again. We also conduct research into strategies for communicating the health dimensions of climate change to health professionals, community leaders, and the public. And this is picking up on what Senator Leno mentioned about a communication strategy and how to balance the messaging so that we don't frighten people, so that we engage people. So we have pilot projects in San Luis Obispo County working with the local health department to figure out how to do this through the doors that they enter. It could be emergency preparedness, it could be chronic disease prevention, and these are just examples that we're working on. We also conducted health research on the co-benefits, especially of active transportation as a strategy for reducing greenhouse gases, and really highlighting what the enormous health co-benefits can be, especially in preventing cancer, chronic heart disease, dementia, some of the things that Senator Leno had mentioned. We're also working and taking that research and translating into practice with the regional transportation planning agencies so they can build that into their sustainable community strategies. We're very fortunate in California to have gotten federal grants to work on climate adaptation. We're one of 16 states getting the BRACE grant, that stands for Building Resilience Against Climate Effects. And what our strategy is to really work with local health departments, regional actors, including the regional collaboratives, who don't necessarily have a health focus, but we're trying to get our health departments involved in that. And as a state agency, I'm involved in some of those regional activities as well. As Secretary Rodriguez said, there's many work products that the CAT has produced, and the Public Health Department has been a contributor to all of those products, whether it's the scoping plan from 2014, the Safeguarding California. We've all contributed chapters to that and reviewed other chapters with the perspective of what the health dimensions are. We've produced our own document, Preparing California for Extreme Heat, Guidance and Recommendations. And there are many recommendations that are still to be followed up on. And it's really gratifying to see that the Heat Island Index, which is an important feature of quantifying where those risks are, is emerging from that. I would just say that in the extreme heat guidance, some of the challenging issues that we face on both adaptation and mitigation have come to the fore. So the issue of using air conditioning as our primary strategy to cool environments down and protect people in their homes and other settings that we know also uses energy that potentially produces greenhouse gas emissions. It also occurs at peak times, so it threatens the grid and potential brownouts and blackouts. We know from our experience in Superstorm Sandy what they call the catastrophic systems failures, cascading can have, where people were in that setting for weeks at times without adequate heating. So we're very concerned about that. We don't necessarily have solutions, but we're raising those issues. And we've, in the fourth assessment, which is another product of the CAT, we've put in evaluating cooling centers as a strategy to do more research, to figure out how to do that in a way that there's more participation. Land use, especially dense land use, which is a strategy, especially when it's coupled with transit-rich assets, is a strategy for greenhouse gas reductions. But there's also a potential for increasing the heat island effect. So these are some of the paradoxes that we face in both our mitigation and adaptation work. I think as Dr. Rudolph mentioned, those big co-benefits from active transport may also have a downside in increased pedestrian injuries. So we need to pay attention to that when we go forward. Urban greening is another strategy for cooling our environments, the placement of parks and amenities. But again, we need to make sure that we're doing it in a way that we don't increase the pollen burden and increase respiratory disease. So these are some of the unintended consequences. I'll just mention some of the regional plugins that are important. Our BRACE project is very consciously trying to work with our local health departments to encourage them to work with their regional planning entities. So all, again, the Bay Area one, the San Diego one, the Sacramento area one, the LA one. I won't use all the acronyms because they're ACN, LARCN, BASERP, and all this other stuff. But the idea is that we are plugged in and encouraging our local health departments to move in that direction so that public health has a voice in those activities. We're also working with the Local Government Commission in a project to provide a health curriculum to the AmeriCorps project that is currently underway, Civic Spark. So we're trying to figure out ways that we can work with that. I should also point out, I'm looking at Christina here, is that between our own Office of Emergency Preparedness and with the emergency preparedness agencies, we're working with how to enhance the climate change and health perspectives in many of their mitigation and heat plans, so that's another area as well. I'll just say in closing that, and it's in a way an echo of Dr. Rudolph's comments, that the actions that we take as California to really build the foundation of health, it's all of those things that reduce chronic disease and improve health and safety is really a pillar of resiliency. We know that a population that has a high degree of chronic disease it will be less resilient. They'll be less able to respond to the challenges of climate change. So promoting healthy communities that have a quality and sustainable environment, adequate levels of social and economic development, health equity, respectful social relationships, that is a pillar of resiliency. And final comment is that we know that mitigation and adaptation are sort of joined at the hip, that they each influence one another, and that this mutual consideration of adverse or benefits, what those impacts are, is not necessarily required now. For example, it might be possible to propose sustainable community strategies that cite transit-oriented development in areas that are threatened by sea level rise and coastal storms. We know with the guidance documents on sea level rise and extreme heat from the COCAT, the Coastal Ocean CAT, and our own public health work group, that provides the kind of guidance that local agencies can use to avoid some of those unintended adverse effects. So thank you very much for hearing my comments.
And welcome, Secretary Laird.
Thank you.
You're moving from one hot seat to the other.
I was delayed because the Assembly Committee wanted to talk about adaptation.
Great. Would you like to give us an overview of the steps that the resource agency is taking on resiliency and adaptation?
Yes, and thank you very much for the opportunity. And I really appreciate the fact that you are focusing on this issue. In 2009, the previous administration did an adaptation strategy. And then last July, we issued the Safeguarding California report, which is essentially a major update to that strategy, which involved many different groups, many different stakeholders. The people I'm testifying with and their departments were involved in many different ways. And it was a comprehensive update that really looked at issues of agriculture, and I got out of the chair so Secretary Ross could get in it over there. She knows she's coming over here, and she will be here as soon as they are done with her. And biodiversity, emergency management, energy, forestry, public health, transportation, and water. And as an agency, we're doing a number of things in relation to that, in relation to the implementation. We're preparing with coordination between all levels of government. We really have multi-agency and stakeholder coordination. We participate as an agency in the climate action team. There are on sub-areas, whether it's oceans or forests, we're doing things, and together with the Environmental Protection Agency, we have set up the forest climate action team. And that's been very important because, quite frankly, in the budget downturn that we came out of, CAL FIRE took such major reductions that unless something was related to firefighting, which in fact was cut, everything else went out the door. And the historic policy team that dealt with forestry issues and would have been our lead on climate change went out the door. And in the last budget, we have the resources to set that back up. And so the CAL FIRE chief is co-chairing with EPA that team. Mm-hmm. And we are working really hard to build the capacity, whether it's counting greenhouse gas emissions in relation to forests, working with EPA and the Air Board to determine the basic issue of whether our forests are actually sinks or emitters in a way that then we can craft the policy that best responds to that in forest practices. We also coordinate closely with the Ocean Protection Council. It's very easy to coordinate with it. I'm the chair. But coordinate with them on sea level rise recommendations. And we are working to implement the Gordon bill on a database. We have a financing wizard that we are putting up so that local governments and different agencies can look and see where there are monies available. in the sea level rise arena. We have done focused research. Part of it was in one area of the coast where we were very pleased to find out that people really, while they were facing individual crises of erosion and buildings being threatened, that they really were more focused on a regional look at what you had to do in terms of adaptation. And we do it also in terms of preparation of science. So the Ocean Protection Council, working with the Ocean Science Trust, actually did science that was unique to California on what was the potential sea level rise. And the irony is that I gavelled to order the Ocean Protection Council meeting that day at 9 o'clock to hear it, and at 8 o'clock that morning, the tsunami from Japan hit the California coast. And the science basically said it really dealt in ranges. So it said in 2050 there is a range with 14 inches of sea level rise being in the middle. But if it turns out that we are really successful globally in limiting emissions, it might be less than 14 inches. If we are not successful, it could be more than 14 inches. And that range for 2100 was in the neighborhood of 4 or 5 feet. And that was a range with the same thing applying. And as I'm fond of saying, and just said in this previous hearing, that day that tsunami hit, it had incredible impacts at the ports of Crescent City and Santa Cruz at low tide before there was any appreciable additional sea level rise. And it is not the concept of a bathtub gradually filling. It is the extreme event. It is the 2-year-old cannonballing into the bathtub. That is the issue that we have to prepare for. And so if you can just imagine that we have some measure of sea level rise and a tsunami hits at high tide, it is a totally different event on the California coast. And we tried to provide guidance because if I came from local government, many people here came through local government. I was mayor and active in a local government that was at sea level. We had a regional water system, a regional wastewater system that were gravity flow tied to the existing sea level. If you are making improvements that are for 50 or 60 or 70 years, you have to be thinking of this. And if you're not, you're going to be redoing fundamental infrastructure in California. If you are doing certain buildings in certain places, it is a fundamental issue. I participate every year in as a graduate of UC Santa Cruz, there's a day, people come and lobby, you get together, and at one of the recent ones, they always have a dinner speaker. They had the head of the Climate Change Institute at UC Santa Cruz speak, and she had a map of the city of Santa Cruz and its levels, and she just did overlays of certain meltings of Antarctica, melting of Greenland, where I thought I was totally safe, less than a mile away from the ocean at 100 feet. I'm not if all that melts. And even when some of it melts, the boardwalk is gone. There's a little island that overlooks where the boardwalk used to be. Those are real issues. And if you look at the Delta, which we have responsibility for in my agency through the Department of Water Resources, and you have some of the Delta Islands that are now below sea level, and there's gravity flow of water into the bay and there's seawater intrusion, the whole balance changes with a change in sea level rise and a change in precipitation patterns because of what happens. And so we have to be ready to move with the change. And we have seen in the agency, and I did a lot of work on it last year because I was speaking about it everywhere, is on fire. If you look at just where we were a year ago, January, or 2 years ago now, there was not a fire in California that CAL FIRE really responded to in the month of January. A year ago, they responded to 473, including 2 in Humboldt County, which is arguably the wettest place in January, usually in California. And if you look at a historic chart of fires in California in the last decades, the season has roughly expanded by 60 days. And you can say, is that directly tied to climate change? When you talk to individual incidents, you can't really talk about the individual incidents. When you talk about the pattern, yes, there is some pattern emerging, and I saw it when I was in local government in the 80s as mayor. We had a water system that served twice as large as our city, twice as many customers. We had 9 different sources. We did not have to draw on our reservoir till May or June because the streams were flowing, and that kept the city going. On average, in the last 10 years, in the Santa Cruz area, those flows have stopped 2 months or 3 months earlier. What was our backup with our reservoir is now much more our central source of supply, and the city has had to adapt in how it measures all the different water sources to water consumption, just with fish requirements being put on top of it. So there are many, many changes that are going on, and we are trying to provide leadership and guidance, particularly to other governments, particularly coordinating within state government, to make sure that we work on that. And when you look at something that you might not think is totally related, which is our water action plan, which was the basis for the framework of the bond, framework of the drought action. It included the groundwater management. It included many of the things we did in water this last year. We said there should be conservation as a way of life. And people argue whether it's 19% or 30%, but some percent that's significant of our energy usage in California goes to the collection, treatment, distribution, and dealing with wastewater, of moving water in a continuum through the system. And so conservation in water is also conservation in energy in that nexus, and conservation in energy as we move to adapt and move to renewables is just a coordinated piece of the puzzle. So I'll just stop because I've talked long enough, but those are just the headlines of what we're doing, and in the conversation or the questions, I'd be happy to answer any questions that you have.